Hey everybody, Karen Anderson here with Aortic for our week in review. I'm telling you, this laryngitis is just not getting 100%, but I'm still digging it a little bit. It's still a little taxing to breathe. And I'm tired, you guys. Phew, got up at like 5 a.m. I don't even know what that looks like. I don't even own an alarm clock. Let's be real. I had an aortic dissection and I threw away the alarm clock. Not that people use them anymore. I suppose they just use their phones, but I don't know what that time looks like unless I'm leaving to go on vacation. Maybe, but somebody usually, like my husband, has to wake me 5 a.m. this morning to get my butt together to get to the airport for like a 7:10 flight. So I'm hurting. I'm hurting. I'm tired. And it was a really busy weekend. I'll tell you more about it later. But before we get started, do me a favor. Click subscribe, click the bell because we've got a couple, well, we have at least one live event. We have two. We have two live events for this week. And then, but that would have been numbers 2 and 3 because we had a live one yesterday with Qigong. So we have so many live events a week. You want to hit the bell. You want to be notified and not rely on your own memory because come on, it's not so great, right? It's just not. Let the bell do the work for you, right? But you are here with me now for a week in review. And I'm going to go over as entertaining as I can the information we had last week. And it looks like I see a million tabs across the top. We have a bunch of different things to talk about last week. So we are going to just take it away. Let's get started. All right. Oh, yay. It was a medical Monday. You know how much I love mispronouncing words for everybody. La, 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 la. All right. So, this particular Medical Monday, we're still in the theme of diagnostic tests. That's the theme for the month of March. March medical tests. I guess that's where they were going with this. And this is going to be a very crucial test when it comes to cardiopulmonary health. And that's called the pulmonary function test or the PFT. I'm not sure how many of you have ever had one of these, but it kind of does look just like this. I did mine in a small enclosed room. If you've ever had a hearing test, and you're in that padded room. That's kind of what it looked like. And you do this breathing in this machine thing, and it's quite challenging. It's quite challenging, but it's actually a series of tests that respiratory therapists can use to examine the overall health of your lungs. And when it comes to exchanging oxygen and carbon dioxide, so who knew, right? It's a whole thing, and obviously the lungs tie into the heart. So uh, it can be an important test in helping physicians excuse me understand maybe why you're having shortness of breath. If there's no fluid on your lungs, let's try to figure out like what's going on, right? That this is the test. It's non-invasive. It's definitely pain-free. It involves breathing in and out of a machine, which, as you see this again, kind of looks like your uh, incentive spirometer. If you've had surgery, everybody gets an incentive spirometer. It's got that same mouthpiece, but it's in a big rectangular box. And every time you would inhale and hold and inhale slowly, this little ball would move, and you want to keep it at a certain level. And it's incentive spirometer because you can see how well you're doing breathing in and expanding your lungs so that you avoid getting pneumonia and you feel incentivized, I guess, by watching the little ball. So it's very similar to this. And what it does is it collects data basically about how well your lungs are functioning, right? So it's a very simple test that can provide this beautiful and informative picture of your respiratory health to diagnose diseases related to your lungs, as well as your risk for respiratory failure following a cardiac operation, which can happen. So let's take a look at the different kinds of PFTs that are available. I didn't even know there was more than one. So there's spirometry. I'm pretty much sure that I had that. And this is a test that will actually measure how much and how quickly one can inhale and exhale. And that kind of helps to diagnose diseases like COPD or asthma, something of the like. So spirometry involves breathing into a tube that's attached to a machine which records airflow, which is pretty much what you just saw above in that picture. Then there's also the lung volume test, or this is a word. This is a word. If you had not told me it was a lung function test, I would have thought it was a dinosaur's name. It starts off with, okay, plethysmography. I just see the word phlegm in there. It could be because I'm coughing, but wait a minute. Plethysmography, plethysmography. The syllable's got to be emphasized someplace. I have no idea. I'm not a doctor. I just play one on TV. All right. So this particular test measures how much air one's lungs can actually hold. And that can actually help to diagnose if you have restrictive lung disease. Okay, never even heard of restrictive lung disease. The lungs are not my forte. But a restrictive lung disease would be pulmonary fibrosis. And so lung volume tests often occur in a chamber where you blow into a mouthpiece. So clearly that was also part of the test that I did. I'm wondering if I did. Yeah, I guess you do all these tests, right? I guess you do them all. All right, so the next one is a diffusion capacity test. Talking about these lungs, making my throat tickle. So this diffusion capacity test actually involves inhaling a small, safe amount of carbon monoxide. Well, that sounds odd. And that really helps to discern how much is absorbed into your lungs. And as a result, physicians get this really good picture of how efficiently oxygen diffuses from the lungs into the bloodstream, as well as helps them diagnose conditions such as emphysema and pulmonary fibrosis. Then there's one that I think we've all kind of seen or maybe heard of, and that's your cardiopulmonary exercise test. So it's a little different than a stress test. I actually went live. I went live on Facebook when I was doing this, and I had this entire massive head contraption on, breathing mask thing. And yeah, it was very strange. It was a little suffocating, but it was a little odd. So this can actually assess the heart and lung functions under stress of exercise. There was no stress of my exercise, which is very important for determining exercise tolerance as well as for pre-surgical planning. I think they did this for me because they were using it as another form of lung tests. So, but overall, there's obviously many different types of PFTs that can help test for different aspects of your lung health, which is a big factor in determining what diseases a patient might be suffering from, as well as if they're a good candidate for surgery. In case of poor results from a PFT, a doctor can recommend effective breathing exercises, there's medications, there's pulmonary rehab to help bring your lung health back on track. Did you know that the lung regenerates itself? I did not know that until my friend had part of her lung resected and then it was starting to grow back. So who wrote this? Let's see who wrote this. So Sai says, thank you so much for joining me on today's Medical Monday. Sai hopes that you have a beautiful, healthy, and active week ahead and take care of your heart and lung health. That was a very interesting post, Sai. Thank you so much. Lung health. Important test. Who's with us?
I
Yeah.
once heard that smokers that have lifelong smokers, like
Yeah.
7 years later, the majority of damage to their lungs has been repaired.
Really?
I know, right? That's amazing. The human body
Yeah,
is a miracle.
it is.
Let's
It really
say
is.
Molly was expecting Tammy. She said, "Hi, Tammy."
I know. I didn't
I know.
change it.
We've got Tom, Christina, Velda in the chat. Hello, everyone.
Hey, everybody.
Christina says 5 a.m. every morning, and she
Ew.
put a little cow emoji in there, and I just know that cow's
No,
going.
it definitely is. That was probably the sound I made this morning when I had to wake up. It probably sounded just like that cow.
Right. And so Velda says, "Hi everyone. 5 a.m. is just to go pee and then back to bed."
100. Actually, for me, that was at 2, and well, no, that was at 4. I woke up at 2, and I was like, I still have 3 hours I can sleep. This is awesome because I couldn't really fall asleep. Um, we're not going to talk about why. I had struggled to fall asleep, but then at like 2, I was so excited because I thought I can get something decent in the next 3 hours. Because I don't need a lot of time to get ready in the morning, especially when I'm flying. I do not look like this. I look like death, but I just kind of put my fingers through my hair, and then I had to, nothing on the face. Because I wear a mask anyway on the plane, so it doesn't matter. This personal choice, I'm wearing it because I'm waiting for my titer to come back to tell me that I am no longer immune to MMR. Big deal, okay? It's a big deal. I know that I'm not, even though I should be, because I had a test done when I thought I was going to volunteer at a hospital before aortic was a thought in my brain, and it came back negative. And they told me I had to have the vaccine, which was a live vaccine, and no doctor would give it to me because I was on immune suppressing drugs at the time. So I wanted to just verify I was really not immune and it wasn't a mistake. And then I have to go get my MMR vaccine. So until then, I don't know where everybody's traveling from. And these cases are so high in Texas and popping up at a couple other places. And let me tell you, that's the last thing I need is measles or mumps or German measles. I don't want any of it. I don't want any, no, nothing. I can't handle a mosquito bite. I could never handle anything that itches or hurts. I would lose my mind. So yeah, so I do the mask thing. So nobody was really going to tell that I looked hellacious. Yeah. So that was that. 5 a.m. Oh, sun's not even up at 5. It's nothing even worth to see. It's dark out. That's kind of chilly, but wasn't really that chilly where I was. All right, we are moving on. We're moving on to Topic Tuesday. This week's post is by our med student, Kiana. Oh, I can't wait to talk about med student stuff. We're going to get to this great post. All right, so we're talking about the theme, this month's theme of CT scans and diagnostic testing, right? Um, so Parab and Adam already talked about echocardiography, right? Or I should say Dr. Ahmed. That'll give you a little hint what we're going to talk about. We already talked about echocardiography and cardiac catheterization. So if you haven't looked at those, you want to take a look at them. But today we're going to go into talking about a CT because there's sometimes confusions about CT, CTA, golden standard, forget an MR or an MRA, or let's just talk about a CT. Let's just narrowly focus on that CT. Gated, non-gated, what's the difference? Huge difference. So we're gonna talk about that. So a CT scan and why it's so important. Um, despite the fact that it's a stagnant image, is an imaging technique that takes hundreds of cross-sectional images and combines them all to create this 3D image of the inside of your body, right? So cardiac CT scans actually show your physician's details of bones, muscles, organs, blood vessels that 2D imaging techniques and X-rays just really can't show. We've shown differences before in pictures, and the CT is much better. So your care team will actually instruct you about the details of preparing for your scan beforehand. And not everybody gets CT scans, right? Don't diss on the people that don't get the CT scan. They're probably not getting it for a reason. It's not for fear of being overradiated, because you're not getting overradiated, okay? It's probably because they're allergic to the dye. And we'll talk about that in a minute. But in general, it is advised and instructed to not eat or drink caffeine a few hours before your scan, okay? We don't really want to get the heart pumping super duper uber fast, right, before you're going to have this scan. And they kind of want you to potentially hold off on some medications, certain medications. So yeah, that you might be instructed with some of those things to prepare for it. But during your CT scan, well, first, before your CT scan, if it's with contrast, you're going to get an IV placed. They're going to lay you down on the table, and they're going to attach you to what looks like the biggest syringes you ever saw. 2 vials of syringes. Typically, one has pure saline and one has a contrast dye in it. It is an iodine-based dye, okay? And so you're going to get attached to that. You're going to lay down on the table. They're going to give you this little squeegee thing that you can squeeze in case you get nervous or you have an issue, whatever the case may be. And this table is going to put you through this donut-shaped scanner. And that's what really allows for the cross-sectional imaging to be taken. So this is a great picture. This is kind of what you look like if it's non-gated. It's like usually gated, you have a whole thing over you and you got electrodes on your chest, right? So that's the key element that's missing here. All right, so let's talk about a couple different ones. So when you are assessing the aorta and aneurysms, a CT angiogram, that is a CTA, that is different. That is commonly used, which is slightly similar, slightly different than a simple cardiac CT scan. So while cardiac CT scans are completely non-invasive, CT angiograms are going to require you to have that dye that's going to be injected. Okay. So you can go and have a non-dye cardiac CT scan. It's just a quick CT scan of the chest without any dye. And it's still very useful. I love when I read online people like, it's not useful, it doesn't show. Of course, it shows something. It's useful. If you're allergic and you can't have dye and you're in the ER, they're either going to do one of two things, not care and stick you in that machine because it's the reason they don't schedule you for an MR when you go in through the ED to get a CT, there's so many letters. The reason they don't do that is because MRI machines take half hour. So they're not always readily available, but a CT scan is like 5 minutes, if that, and they're always readily available. And you can bump somebody from that easily and put a potentially dissecting patient in there, right? So you don't have to have dye. If it's a matter of life and death, they're not going to pre-medicate you and have you sitting there waiting, doing a ton of meds for like a quick hour or a ton of meds and make you wait 4 hours. The protocols are just different. They're just going to put you in. That's just your general, completely non-invasive scan. So when it switches from non-invasive to minimally is when you have to have an IV because now I guess they consider it, they've invaded your body. They've put a needle in. Again, I'm not a doctor. I'm just guessing these things out loud. But the IV goes in. We just talked about this, right? And it's going to help highlight those blood vessels. That's what the dye does. It emphasizes everything. It makes you glow. I always say that when I leave there, if I go home and turn off all the lights, I'm going to glow. It's not true. It's just a really bad joke. And again, the scan, 10 minutes or less for the whole process. Because if you're having the dye, if you're having a CTA, you're going to get salines going through, and then they're going to announce on the little speaker system, we're about to inject the dye. Let's talk about the dye because I look ahead. I don't think that they talk about it. Let's be real about the dye. Okay. It should not burn, right? It shouldn't make you feel itchy. It shouldn't make you feel like you're being stung by a million bees. If it does that, you need to squeeze the bulb because that means you're having a reaction. And most people don't know that they're having a reaction or that they're allergic until they discover they are in the machine. And then they'll put down that you have an iodine allergy, but that doesn't mean you're allergic to shellfish, which is directly related to iodine allergies. I can have shellfish, but I can't have the dye. So if you feel something that's more than just warmth of a liquid and it's uncomfortable, you need to squeeze the bulb because they can give you medication to try to help combat all of that. You don't want it to turn into something anaphylactic. Okay. So assuming everything goes well, because 99.9% of the time it does, you're going to feel really warm. And you can like literally like I pay attention. I get very anxious when I've had to have them, even though I'm on a ton of Benadryl and half asleep, but also on prednisone, so I'm buzzing when I have to have these. I can feel it and I kind of scan it as it goes up my arm, around the shoulder, through my head, and then straight down my body. And then you're going to feel like you have to pee. This just happens. So all the warmth just goes, whoom, and you're like, shoot, I have to pee. And then you realize, no, I don't. It's just the dye. Nobody tells you it's going to be a very exciting surprise, but it doesn't hurt and it goes away very quickly. But it is like, ooh, that's extremely warm. So what is that? That's the dye. So just letting you know how it works. All right, so let's get back to CT scans and why they're used and how they're used. So they're used to measure the size of the aorta. We know this. They want to detect any aneurysms or any dissections, right? It's the easiest one, again, because it's so easy to get into so quickly in an ER. It is a key diagnostic tool when it comes to assisting physicians in making that initial diagnosis for an aortic aneurysm. Following that initial diagnosis, the CT scan is a critical tool when used to surveillance your aneurysm over time. Depending on the size and location of your aneurysm, as well as other risk factors, your surgeon's going to typically recommend repeat CT scans every 6 months to every year to continue to monitor and measure your aneurysm for any growth. Basically, that's the key. Let's take a look what that looks like. So here we are right at the root. This is right where your aorta is coming into the heart. It's very interesting. This is called your sinus of Valsalva. So right in here is going to be, I'm pretty sure it's going to be your valve in this area. You have the sinotubular junction. Oh my God, I just impressed myself. And then we're going all the way up through the arch. So this is your ascending. Okay. This is 3 to 4 centimeters. That's what that looks like right there. And that is above your aortic valve. Okay. Or maybe it means it's 3 to 4 centimeters above the aortic valve. Is it a 3 to 4 centimeter? It doesn't matter. It's not an aneurysm, so it's fine. This is right where we get into the aortic arch. So here's where we're going into these zones. See this? Remember we talked about the fact that the aorta is now its own organ when we've mapped out these zones. Okay, so that's what they're showing you, I believe, in here. And in B, here is where they are taking, I believe, this looks like it's a cross section of the aorta going straight across. And if I'm correct, there is no dissection in here, right? So it's just all one color, full of dye. And this looks like we're in an area, I'm pretty sure this is right around the annulus and right around where the valve is. Again, I'm not a doctor. I try to remember really hard all the things I learned from all the physicians on this YouTube channel. But I think I could be right, but I'm never going to know because that's all for this week on our Topic Tuesday. But coming up, we are going to learn about the final imaging method of, which is how to take a look at the carotid. And that's important too. So when you're having an echo, they will often roll the ultrasound wand around the neck. That is actually all in of itself another separate test they can do, but sometimes they include that and a sniff test right at the base of your throat. So we're going to talk all about that at another time. So yeah, this is still very interesting. What Kiana didn't talk about was why it's so important to have a gated CT scan. And so again, gated is with electrodes on your chest. So it's kind of monitoring it back in the control room like an EKG, right? And that's because when your heart beats and pushes out um, all of that blood, your your aorta moves. We're not stagnant. Even when you think you're just doing nothing, all kinds of things are happening in your body. Your intestines moving around, they're wiggling, and your lungs are moving, and your heart's beating, and your aorta's wiggling, and your veins are moving. Everything's moving. So you don't want to capture these stagnant images when a big push of blood has been pushed out from your heart because it might make that aorta look like it expanded. So having it gated makes a big difference because, sometimes we're talking about a difference of a few millimeters in making a decision to move forward with surgery. So that's why your doctors always want you to have a gated CT. And remember, where you have your scans, you always want to try to have it at the same facility because then it's going to be read by the same people in the same machine. And it does make a difference. It does make a difference. So that's my 2 cents added in. But talk to your own physician if you have a question about it and let them explain it to you a little bit further. It's Topic Tuesday, Topic Tuesday. That's what I got. Josh, you're chatting away with everybody.
No, chat's pretty quiet today.
Oh, why does everybody got to be so quiet? It's all right. I'm good with it. I'm just going to move on to exciting things. And that would be Hope Mail. And I know it's exciting because whenever we do a post, we get like a gazillion people sign up, which like makes me really happy. This was this is this year's Hope Mail, you guys. I forgot last year's was our like mantra coloring book and crayons and a some feely touchy feely tactile thing to help with stress and anxiety, which actually made me stressful and anxiety full touching that. I don't like that tactile stuff. But this is this year. So on the theme of how to thrive in 2025, right? We make things a little bit easier for you. And also, because you're supposed to learn how to ace your healthcare journey, we wanted to include a journal for you to be able to take notes and come prepared to your doctor's appointment with the aortic pen, which writes beautifully, by the way. And I'm a pen collector. This is where you can prepare and have some questions. And of course, like the jar openers, so handy, so helpful. You can't bear down to open up this stuff and you use it. It's amazing to me every time I use that jar opener, things just pop right open. And then I don't have to bear down and like turn red faced. So, funny story for those of you that don't know. Hope Mail got started because I took up knitting right after Aortic Hope was conceived in like 2016, 2017. I took up knitting and I was loom knitting a heart-shaped little teeny pillow that I stuffed and the whole 9 yards. And I sent it to a community member because I knew she was having her aortiversary. And I was like, this sounds like it's a fun thing. I'm just going to send her something. I don't even know how that all came to be, honestly. But then some people saw and they were like, I want one and I want one. And I'm like, I am not going to become some 45-year-old that has no life and just knits. Right. So we did a GoFundMe, we raised money, and we purchased our first items. And that was a keychain that lit up, and it was a stress ball. I'm going to say those were our first two items. And we had 32 people sign up for this, which I'm going to go into detail what that is. And now we have over 300 some people receiving Hope Mail in the course of a day. So basically what happens is you sign up using the link here or under programs, and it's free. And what you will get is one time a year. So come on, you overachievers who like to have more than one surgery or more than one major diagnosis, you got to pick one date. Okay. So we will find your name more than once and we will pick a date for you. So you pick your one date that you're going to celebrate or you want us to cheer you on. And we will send you during that month at some point, not on the day. I guarantee it will be a fluke if it arrives on the day. But at some point during the month, you will receive a small package, like you see above here, of our acknowledgement, also our appreciation that you're with us. Just a little token to let you know we got you and we're happy that you hit whatever milestone you're hitting and we hope you're doing well. And that's it. That's really it. The key here, the most important thing is if you've signed up and you don't get something, I am almost 100% sure it's because you moved and you forgot to tell us. And I sent it and then it got sent back. So you moved, you got to send us an email at info@aortichope.org. Please send an email and just say, hey, I moved. I signed up for Hope Mail. Can you make this change? Here's the month that I'm in. And then we will go in and make that change for you. If you sign up towards the end of a month, you're going to probably have to wait until the next year because most of our Hope Mail goes out by the 15th so that people who already had their aortiversary and people whose aortiversaries are about to come, they get to kind of celebrate right there in the middle. So I don't want to wait until it's too late because then people in the beginning of the month are like, "Where's my prize?" and all this stuff. So if you wait till the end or the next month, you're going to have to wait till the beginning of the month. So that's all I ask. If you move, please let me know. But Hope Mail's fun, and we have a really good time trying to think about what we can order that kind of goes with the theme. And you know what? If you guys had any suggestions, please drop us a line. I love the ideas that people come up with. Somebody made the idea of the decal and now that's like a hit. So yeah, come if you have ideas, let us know. We're always open to looking into that and seeing if we can make your wish come true. And that's Hope Mail. Okay. You would tell me if there's something to chat about, right? Yes, you would. I feel confident in you, Josh. Okay. We're moving on to another thing.
There is a
So,
comment.
what is it?
Velda just posted, I love my Hope Mail this year, especially the little journal and the pen.
Oh, very good. Very, very good. I'm glad you like it. So I'm curious to know, Velda, and I'll probably start before you get that answer because we're on delay. But there seems to be this thing where when people want to try out a pen, you got to write something. So if I handed you a new pen, I'm like, hey, tell me if you like how it writes. What do you write? I didn't even know it was a thing that people typically write the same thing. It could just be scribble, and that's what they always do. I always write my name. I love writing my name. I love cursive script my name. My sister, Ellen, writes the word Chicago. That's how she tests out if it's a good pen. If she writes the word Chicago and it writes really well, she then will take the pen. Yeah. And I think that she might carry pens. So if she comes across a pen she likes, she swaps it out, takes it home, puts another pen in its place. I'm very big on pens. I just love I love purple ink. Blue's my second. I hate black, but I love a really good, fantastic gel, medium. Just, I love it. I'm a pen person. But then again, you could put me in Home Depot and I will find something that I love there too. Typically the wood section. I'm the weirdo that's in the section grabbing a block of wood and smelling the wood. I think it smells so good. I love playing with the knobs and the keys and the locks. I put me in Office Depot, I'm right over to the keyboards and I am just typing away. When they used to have cash registers, I used to play on those too. But now it's pens and it's keyboards. I could buy something anywhere. Like I'm a girl. Just give me cash and I'll find a way to spend it. All right, we're moving on. So resources. Um, if you're going to be having surgery or you have just had surgery, and you want some pre and post op suggestions, it's very easy. We've had these resources written by the community, so we know they're tried and true, and they're meant for the community. And we've had them now for over 8 years. Um, you know, you can always shoot us an email if you want, but it's so much easier just to click on the link and resources, and we're going to talk about them in a second. Um, this list has been growing over the last 8 years, and it's always available to you. A lot of it is also listed under the questions that you could ask under the aortic dissection, the patient guide, and there will also be an expanded version of questions in aortic disease, the patient guide. These are going to be very helpful for you post-diagnosis and treatment. So we're going to take a look at some of these suggestions real quick. I must have copied their link wrong. I did it. I did a bad. I made a boo-boo. Oh, because it's got these dots in here. Yep, something got jacked up. I'll have to fix that. Um, I'm just going to do it. I'm going for it. Here I go. We're going for it. I'm going to find it. It's not hard. There it is. See, look how easy it was. Pre and post surgical suggestions. Okay, so let's go over some of these because I think these are pretty important. So it is strongly suggested, okay, that you have a loved one or friend with you during your consultation or your pre-op appointment because your mind as the patient's going to be blank, off, scattered, not paying attention, scared, a million more questions. You're already thinking ahead and you're not paying attention. So you want that second set of ears there with you to take the notes. Also, because they may have a question that you didn't think of in your fear and whatever, right? They may have done some midnight research and have a really great, like my husband asked the question, did she experience any malperfusion? And I sat there looking at him at my first clinic visit after being cracked open. And I'm like, I don't even know what that word means. How do you spell that word? Like, how do you, he did research and he wanted to know. He wanted to know what happened to me. So pretty important. Also, you want to make sure that you make those lists of topics you want to discuss with your physician and have everything handy. Obviously, use the journal, use the back of a book, take a piece of paper, it doesn't matter. But here's some of the good questions that you might want to ask. How long will surgery last? It's good to have an idea of an expectation. Doesn't mean that's going to work out that way. And the key thing here is if it doesn't happen that way, don't freak out. Don't freak. Anything could have delayed it. In my case, the doctor came in an hour early and everybody got scared thinking something terrible happened. Nope, he just got done early. There was no surprises and he got done early. So I did great. In other people's cases, the doctor could run another hour, 2 hours longer. And that's okay because maybe there's extra things that they want to check out, right? So don't, you have to trust the process, but get that understanding of what the expectation could be and ask questions such as, how can I follow up? If I'm sitting out there, is there a number? Sometimes they refer numbers instead of names on a board where you can keep track of what the patient's doing and where they are in the procedure. Sometimes there's a phone number, there's a phone in the family area you can pick up and call, and there's a rep that can then find out from the OR where everything is and how it's going, right? So you have to find out how you can get your questions answered. How long do you think you're going to be in the hospital? Will there be a step down unit? Like what happens? Is there a rehab? Get all those ideas as well. What exactly is this procedure? What is it? What's the plan? Are we possibly replacing a valve? And if we are, let's start that conversation on what that looks like. Okay, because there could be so many other branch off conversations. If you're younger in childbearing age, having a mechanical versus a tissue very much could make a difference in those pregnancy plans. Um, and your age might make a difference on the valve they would prefer to use. So there's a lot of things to talk about because you go into it not thinking they're going to touch your valve, but then maybe something goes awry, right? So you want to have all these kinds of conversations. What's the risks and benefits to one procedure over another, etc. What can you expect when you wake up? Number one question, am I going to know my breathing tube is in? Well, and if you do, hopefully won't remember it when you really wake up, right? I mean, I don't, I know some people remember or they think they remember, um, and maybe they've had issues or they've gagged or something like that. But, um, then other people have funny memories about stuff like that, honestly. But it's important to ask, will I know if I'm too awake and I'm agitated? Will you knock me back out? What kind of pain? What's it feel like when a chest tube comes out? These are all great questions. And I would say ask your community, right? Because they've been through it. Go to a support group meeting before. Ask some of your fellow community members. These questions are going to be honest. They're going to tell you what their experience was. Doesn't mean that's yours, but it's always good to hear what other people have experienced. Pain management. You want to have a plan. I'm very upfront when I have to have surgeries, and I tell people I do not like pain. I do not like it. I do not want it. What do I do if you're giving me something that's not working? Like, I don't know. I gotta I need pain gone. I don't like chasing pain. I want to be ahead of the pain. So what does that look like? What's that going to mean mean for you? Can a loved one spend the night? This was a really interesting question because if you guys remember, there was over a year where nobody was spending the night. First time nobody could spend nights with you in the hospital. And I venture to say a lot of areas that has lessened, that has lightened. So you want to ask these questions if that's what's important to you. If you're somebody who tends to become anxious or worried, can you get a little something something to take the edge off? On operating day, right, or procedure day. Let them tell you what they're willing to give you and what that's going to feel like. How's that going to change the experience for you? We talked about seeing if a family member could stay in the hospital. Good one. Suggestions of things to pack. This is not like having a baby. I love when people say bring silk pajamas. I had to write it down. Somebody in the community said it. Heck no. Heck no. I mean, maybe some of you feel really good. You're like, I'm to put on my silky pajamas. No, you don't want to get blood or fluids or anything on it. I mean, the only part that I think would be practical is it is silky. It does stay cooling, and they're typically buttoning in the front. So for men and women, it's a lot easier than you really can't want to put your arms over your head and try to pull something over. But you know what? This is where the hospital gowns are really fine. They're fine. Okay. This is not going to be a pretty beauty runway model event. It is gnarly. And just wear the gowns. It's so much easier to take them on and off, or sponge baths, or if you get into the shower. Um, but that was a suggestion. Slippers or socks. But if you're going to wear any of those, you want them to be well treaded. The last thing you need is to slip on those floors after they've been cleaned, by environmental. You don't want that to happen. But they are cuter, right? And make you feel a little bit more like home than the ones that they give you in the hospital. However, if you are a fall risk, they're going to make you wear the colored socks they give you. I did not know this, but every color means something different. It does. So if you're at risk for falling or a bleeding issue, they may say, no, you got to kind of have to wear these yellow socks, right? So find that out, but it doesn't hurt to bring it if you wanted to. Women, don't worry about a bra. It's not going to be your friend, or it may be your friend. It depends. 50-50, right? The hospital typically, if you're having open heart surgery and you're a woman, you typically wake up with a bra already on. And I don't know if all hospitals offer ones that close in the front, but mine did. I was stunned by that because I was like, look at this contraption. It was so comfortable. When I took that off, I thought it would be more comfortable, and it was so much worse. Think about that. I don't need to explain why, but it was worse. Gravity is not your friend after you've had open heart surgery. So sometimes keeping that bra or a sports bra on, which again might be challenging if you can't, if it's one that's a one piece you have to pull over your head, that's going to be challenging with putting your arms up in the air. You want things to be comfortable. And the easiest way to get to comfort is the best way. Okay. If they do offer you these bras in the hospital, pay the extra money and buy an extra one because you might want to wear it for a long time afterwards. And they're not that easy to necessarily find online, the ones that the great special ones the hospitals have. All right, we've talked a lot about essential oils. And we will get into a post about that soon, all about how to ground yourself with five senses, one being scent. But essential oils, they do a lot of good in a hospital. So lavender, chamomile, rose, frankincense, they are known to reduce stress and anxiety and actually help promote relaxation. Some hospitals will actually provide you with lavender oil that you can use. And they work. So just a little dib dab here or there, it can really help with the stress and anxiety. This is probably going to get mentioned at one point, but I'm going to mention it now just in case it wasn't. But peppermint. Peppermint is a very interesting smell because everybody's going to have, if you're going to have open heart surgery, I don't think this happens if you're having endovascular, but definitely with any open surgery, you're going to have a urinary catheter put in. So we know how great those feel when they come out. And sometimes because your bladder has been put into not a coma. What I want to say? Paralyzed, because the bladder's been kind of like paralyzed for during surgery and stuff. When it's awakening, it can sometimes feel very irritated, and then you kind of clench up and you don't go to the bathroom. And if you don't after like 6 or 8 hours, they want to recath you, and you don't want that. If you drop a couple drops of peppermint oil into the bathroom, into the toilet, or you even smell peppermint like from toothpaste or an Altoid. Just rub it with your tooth and then smell it. It relaxes everything and you go to the bathroom. It is amazing. And I know this because it was given to me after I had my son and had a C-section. I had to go to the bathroom so bad I was begging to be recathed. And the nurse came over and she put the 2 drops in the toilet and I went right away. And I have always made sure to have pepper with me. And every single surgery where I know a cath is going to be involved, I make sure to have peppermint. It helped with my father. He had prostate issues and he was going to need to be recath. And I'm like, here, pass him down some peppermint. And it worked. So it's worked on more than just me and my dad. It's worked on many people. Just try it. Try it before you ask to be recathed. It's worth trying, right? And if you have to be recathed, you have to be recathed. All right. A suggestion was made to pack toiletries. I'm on the fence because, well, no, I guess I'm not. Hospitals will give you roll-on deodorant. If you like that wet feeling, you're used to that, then it's no big deal. They will give you that and a toothbrush and some toothpaste and a dry shampoo and a body wash and a comb and tissues. They give you like a bunch of toiletries, and if you run out, you can always ask for more. I'm sure they may end up costing you like $1 billion if they charge you for them. I don't know. But sometimes having your own toiletries from home, just that feeling of something from home makes you start to feel better because you know you're getting closer to going home. I think that's the psychological twist on that, right? Um, a lot of people never even find the showers in their rooms. They never make it there. They just recover and have sponge baths, right? And so maybe bring a dry shampoo if it's important to you, and your own brush. And if you want to shave, bring a razor of some sort. But just whatever you bring, you got to bring all this stuff home. And in the ICU or the SICU, they're not going to allow flowers. So that's good. But if you're going to go to a step down unit, now you got all this junk you got to bring home, right? Or your loved one's bringing home in stages for you. So, you know, the important stuff, cell phone charger, that's important. You want to have that with you, right? Don't worry about iPads, and you're not watching movies. You're not doing that. You're going to have that energy. You're not going to have that kind of energy. Um, accept visitors. You want to let the visitors come in, and they want to know that you're okay. And sometimes seeing people from home just makes you feel happy, right? And it helps to lighten some things up. I think I spent most of the time apologizing because I could not stay awake. And I would sleep every time someone was there. They would just sit there with me for hours and I would just be opening an eye and they would still be there. And I would always say, I'm so sorry. And they're like, Just sleep." But takes a lot out of you, right? And so, but I was happy to see people there. Um, don't try to tough it out when it comes to pain. You really don't want to be chasing pain. If you can take pain medication, you want to stay ahead of the pain. So, and if you're in too much pain, you need to learn some breathing exercises and grounding exercises that will help manage it until there's a change of shift or you get your medication. But if your hospital offers you a PCA, which is a patient controlled analgesia machine, it's a button. It's hooked up to an IV pack or some pack that administers, it's not IV, but it's something that goes through the IV. When you hit the button, the medication comes out. It doesn't matter if you hit it 15 times in a row. It's only going to give what it's allowed to give. So That's all mind over matter. It's not going to administer more medication than it's allowed to, or sooner than it can. But at least you have some control, and you're not always having to hit the call button to say, I need medication. If you don't get a PCA, right? Don't hesitate using that call button, right? So in a ICU or a SICU, cardiac ICU, typically the patient nurse ratio is like 2 to 1. There's 2 patients for 1 nurse. So you're not really bothering anybody. You're not overworking. The staff is there to help you. So you need to let them know you're hurting, or they're not going to know. They're not going to be able to monitor this. And maybe that's the explanation. If you have higher blood pressure, it's because you're in pain and you're not talking, right? Plus, if you can manage your pain, then you might be able to sit up better. You might be able to walk sooner or walk longer. And walking is so good for you, as is rest. But walking's really important part of the process, and you want to kind of do that as comfortably as you can. This was also important for another community member. They felt it was important for someone to take pictures of you. I know that sounds odd, but in the short time you're in the hospital, from the moment let's say you have a dissection, okay? From the moment you get in, you might be in pain and be uncomfortable. Sometimes people want to take pictures because they don't know if you're going to come out of it, right? Then you're going to come out of surgery and you're just going to look like hell, like a truck ran you over. You're going to have a million wires in you. And then when you're about to be discharged, it's like you look so different. So to see that process over such a short period of time, whether it's a week, 3 months, however long you're in, is sometimes important to have that visual element to know that you're getting better, because we don't always know, because we don't feel it. And we've seen lots of pictures from survivors in the community, and they have situations that are similar to what we've had. And you can always choose not to view those, but sometimes people find them comforting. So it's a choice, personal choice, up to you. But many survivors find it very therapeutic to be able to look back and see a record of where they were and how far they've come along, right? So it's, again, a personal choice. Talk to a close personal friend or family member to make those posts on Facebook. Or you can always create a caring bridge. You can use caringbridge.org. I believe this is free, and it's a tool so that people don't bother you constantly. How are you? How are you? How are you? Or bother your family members. They can put a picture up. They can just say, hey, this is what happened to so and so, or so and so went back for scheduled surgery. Here's an update. I'll update in 3 hours. You don't have to be bothered. Nobody's bothered. They can even attach it to a way to make donations for a charity like ours or anybody else's. But Caring Bridge is a great site, and it is a really important tool in updating your friends and family. And when you feel ready, of course, you make your own updates too. If friends and family are coming, tell them to bring games and cards, because they're going to want to keep themselves busy, even though they're seeing you, because you're going to be tired and you might be out of it. And maybe when you're starting to feel better, you might want to take a stab at playing a game of Yahtzee with them. Who knows? But it's good. When it's a scheduled surgery, 6 hours is a long time, right? 4 to 8 or 4 to 10 hours. It's a wide span. And even though scheduled surgery is not as scary as emergency, you still want to kind of have something to do with your time. So, but I guess that's their personal choice, right? Personal choice. Again, ask questions about your surgery and what it's going to be like when you're in recovery. So you might not really remember what it was like to be in the hospital to begin with. So it is important for some people to say to the doctor, tell me what happened. Explain what's in my medical record. If you're someone that doesn't want to know, because reading these medical records, they can be very scary to see your name associated with having your heart turned off, right? And being put on bypass and then having it shocked to start it back. It's like it's very jarring to see your name and to read that and think, wait a minute, that happened to me. And so decide if you're the kind of person that is going to be comfortable, or is that going to create more stress for you? Okay. Um, it's okay to cry. Open heart surgery. Any surgery, actually, where you've been under anesthesia, reports have shown that it is very normal for people to experience uh, periods of time of depression. It's like the blues, they call it. Okay. And maybe that's just a way of emptying out anesthesia that's in your body, or it's the brain's way of finally healing from what's happened in itself. Um, Crying spells might only last a couple weeks. Statistically, it does tend to happen more for men, they say, than women. So if you are a caregiver and you see your husband and they are crying because a kitten is on TV, do not be alarmed at something like that. Okay, these things have been reported as normal. However, after a couple weeks, if there's sleep disturbances, if there's smelling things that aren't there, hearing things that aren't there, disturbing thoughts, periods of issues with short-term memory, you might want to talk to your physician or find a social worker and try to see if you need some form of therapy to talk things through and then determine if there's something there that you might want to work on further. So for this to last months and months would not necessarily be normal. Weeks, sure, but definitely realize that emotional mental health is as important, if not more sometimes than your physical, because your body physically heals, but then the mind is a very interesting thing and that can last for a really long time and you don't want to torture yourself. All right, we talked about the peppermint, tried and true. We've talked about it. We're going to move on. Another great tip from some survivors: potassium. If your potassium level is low, and it can happen to anybody, they're going to want to give it to you via IV. It's the fastest way. Just know a couple things, okay? It does come in liquid form. It's disgusting, but it does come in liquid form, and it's disgusting. It is. And it does come in pill form. Very, 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 very big pills. Those forms, liquid and the pill, can cause some gastric upset. IV, IV being pushed too fast without enough saline is going to feel like they have lit your veins on fire. I'm just telling it to you. I'm being honest. Again, I know this might not happen to everybody. This is what happened to me and a few other people I've talked to. When potassium goes in too fast, and if it's not, I can't think of the word I want to say right now. If it's not weakened, lack of a better word, by having some saline, it's burns. Like mine actually rose to the surface and they were beet red. And I was hitting that call button. I was hysterical. And this nice nurse aide came in and he turned it off and he flushed my arm with water to get it all through my system. I was aching. It was like heavens opened up and shined a light on this man. And I thought, I will live to see another day. It was so painful. And then I said to them, I'm not leaving for at least a week. You will drip that. I don't care if it takes all week to put it in me. It will get in me, but it needs to be like for every drip of potassium, I like want 10 of saline. A senior healthcare journey, right? It all comes down to advocating, communicating, and educating. Hey, my veins are blood red. It's just burning like acid. I'm not going to take it in this form unless you reduce my pain because they don't have it in their vein. And if they've never had it, they don't know how bad it feels, and it does not feel good. You got to speak up, okay? But nurses are amazing. But sometimes we might not mesh with a nurse. Oh God, it's the worst situation, right? It's the worst when you're not meshing, when they're moving you too fast, when they're coming in and out and they're handing you meds and they're not clearly explaining to you what you're taking or why this test is, and they don't give you a chance to say, wait, that's not what I'm supposed to be doing, because we're always scared to speak up, right? Which is why How to Ace Your Healthcare Journey was created. It is okay to ask to speak with a charge nurse. This person's not going to lose their job. Tell the charge nurse, I would like a different night nurse. I would like a different day nurse. We are just not melding together. It's okay. There's different lids for different pots. It's all right. You shouldn't have any unnecessary stress. Make a change. As Michael Jackson says, make that change. You can do it. You can do it. I know you can do it. All right. Ask your physician if they're going to be ordering you cardiac rehab. If you do not qualify for cardiac rehab, you should look into physical therapy. Ask them to give you a script for physical therapy because many open heart surgery patients, especially, have talked about how they have trouble with their posture because for the first 12 weeks, your sternum's healing. They have problems with stamina, with strength, issues in their arms. A lot of people report numbness, especially in their right arm. I think that's for the arterial line that they put in. Shoulder pain, even problems with just breathing and feeling shortness of breath. Cardiac rehab puts electrodes on you. They monitor your heart rate. They monitor it on an EKG. They start you off very slowly, going by your perceived rates of exertion, right? Your PREs. Start you off on a treadmill, start you off on a bike, maybe a little bit of a elliptical, who knows, some small weight training, and they gradually build you up to more and more and more and more time. And they're always reporting this information back to your physician. Plus, they give you education on nutrition, on other different things while you're in these classes. PT will not do the education part, but they will report your heart rate and your blood pressure back to your physicians. They won't have an EKG, but they will report those numbers back. And they will work with you one on one instead of having a class of people that might have been in for bypass or many other heart issues. They will work with you one on one to just start with diaphragmatic breathing. Just learn how to breathe and sit in a chair. After open heart surgery, you'd be amazed what a chore that can sometimes be, just to feel competent to sit in a chair and feel yourself breathing and feel your heart beating. It's mind blowing how it's incredible that you feel so weird that you're even alive, right? Everybody's journey is different, but they can work with you on taking those first few steps. The same things, the treadmill, the bike, the everything, but it is in a little bit more of a one-on-one setting that you will get approved for from your insurance. Cardiac rehab, they usually want your valve involved in some way, shape, or form. Sometimes you can get away with getting cardiac rehab if your valve was resuspended. All of these are good questions to talk to your physician about, okay? Sometimes you might have this numbness in your arm from one of those arterial lines. That numbness may or may not go away completely, but PT can help with that. It is desensitization techniques that involve, you're ready for this, scratching on the arm, taking a Q-tip and using the soft part or using the hard part. It is firing up the nerves and trying to make them reconnect because they've been damaged from the lines that they put in. It is not comfortable. It is not painful. It is irritating and annoying, but it does help the nerves connect faster. I've heard many people talk about that issue. Some people are left with pain in their shoulder. If it's an emergency surgery, doctors do not care about positioning you. They whip your arms out to the side because they just want to get you in position for surgery as fast as possible. Well, for some people, that might leave you with the beginnings of a frozen shoulder, potential torn rotator cuff, all these other issues. PT can help with all of that as well. So don't accept these other aches and pains as just something that happened. Talk to your physician about it, right? Because aches and pains and inflammation can potentially impact our heart rate or blood pressure. So you just want to communicate ACE, ACE, ACE the rest of that journey, right? Mental health. Some people talk about feeling blue, general depression after surgery. We talked about that. That's normal. Don't hesitate reaching out to a licensed clinical social worker with your emotions. There's EMDR, there's CBT, there's so many different forms of therapy that you can undergo if necessary. Also, Aortic Hope, we offer all of these support groups virtually um, through our through our Microsoft Teams. So, we're here. We're a community of survivors and caregivers, and we utilize our own stories as a tool to help the community. So all of these resources are available to you 24 hours a day just by clicking the resources tab. Again, that page looks like it starts off right here with our book. You scroll right down till you see the big gigantic heart right here, pre and post surgical suggestions. And if you have a suggestion you think would be very important, this post is actually put right now on our Facebook page. It is pinned to the top of the page. Feel free to go inside and leave a comment. And that is what that graphic's going to look like right there. So that's our resources available post. That's a lot. Such good information, though. Such good stuff.
You're not wrong. On the previous post, Velda said, I write my name.
Oh, see? Two peas in a pod.
Right?
Velda and
I don't know who taught me, but I do figure eights so that I can see all angles of the pen.
Well, okay, I'm doing that right now on my pad of paper right
I see you thinking about it.
Okay.
I don't know who taught me.
Figure
I don't
eights.
know if it was an art teacher or a buddy of mine who was into art, and like you said, he collects pens. But I want to say that I used to just be a scribbler, just back and forth
Oh,
scribbler.
yeah.
And he was like, now, if you do it this way, you get to roll the ball the entire way around and make sure that the ballpoint pen is rolling. And I was like, oh, that's interesting.
Okay.
And I've done it that way ever since.
See, everybody does something.
Mm-hmm, mm-hmm.
Never even gave that thought. Interesting. All right, we're moving on to a hearty welcome to, she is known online as Kristen Jefferson. Anderson. That's my last name. Kristen Jefferson. She's our new community liaison. Now, here's an interesting story. Since we made her the offer to officially volunteer with us. Okay. She's already become maybe a fundraiser, right? Maybe working in support groups. I don't know. She can really do it all, but I got a chance to see her at work. Terry Cook and I were at a fundraiser this weekend in Charleston, South Carolina, at the Palmetto Brewing Company. So shout out to them for hosting such a wonderful event with 90s cover tunes provided by a band As If. That's their name. And my dear friend Keith Trimble, who's an interventional radiologist with East Cooper Medical Center, he's in the band, plays guitar, plays bass, plays keyboards and piano. He just plays, and sings beautifully. I had no clue. I've never seen him play before. It was so exciting for me. I was totally fangirling. It was awesome. I've known him for over 20 years. And they did this fundraiser for us. So it was lovely. This was a stop on a trolley line. So people were coming in, people were leaving, more people coming in, lots of kids dancing, having a great time. Lots of great, generous donations from both the brewing company and from the patrons that were there. And you know, Kristen, she just walks around and she just jumped right in telling everybody about aortic disease. See, she was a phlebotomist, but she's also a medical assistant. So she does assist as like a med surge tech. So actually, she had to leave early because she knew she was having a surgery that day at her hospital. And she texted me and said it ended up being somebody potentially with an aortic dissection. They couldn't treat that person there, but they were coming in for something else and discovered there might have been this potentially big issue going on. I was like, what are the chances of that happening? Right? It was just wild. So, so she's really is known as Kristen Taylor, you guys, but she hasn't changed her name on Facebook. So if you want to defriend her, she's Kristen Jefferson. So she's 38 and her birthday is March 30th. And she's currently in the medical field. She is a type A dissection survivor. December was her 5-year aortiversary, and she loves us. She loves Aortic because the love and support she feels has been very genuine and right on time since the start of her journey. She was 34 when her dissection happened, and nobody her age that she knew had ever experienced anything like that. And the doctors near her really couldn't recommend any support groups because it's quite rare, as we know, right? And especially for someone that's in that younger age bracket. But she really looks forward to serving the community, and she finds it to be a blessing to be part of something so important and life changing. So we welcome Kristen. Yay! So excited. It's always so great.
Welcome, Kristen.
Yeah, it was so nice to meet her with her aortic hope shirt. She came prancing in. It was great. Okay. And we also welcomed Dante Barnett. We welcomed him like a day or two before he did his live Survivor series, which I didn't get to see because I was trancing around Charleston. Well, no, that was the day of the event. That was Saturday. So, I was still at the event, which then it got cold, but it was still wonderful. All right. So we also want to welcome Dante Barnett, spelled as if it's Duante. And I know he makes a joke about that all the time. And he should, because I work so hard on my posts and autocorrect put it out as DAU. And I didn't even see it till he told me. And then I was mortified and went and changed everything. So it's Dante Barnett. He is going to be a community liaison. That's because he really wants to be out in the community spreading awareness. And he's going to do it with his own form of humor. Okay. So, he wants to share a story through comedy if he can. He's going to bring awareness to the community through a variety of comedy shows and hopefully podcasts in the future. And I know that he wants to start to schedule a big comedy show, and he's moving to Hawaii in May. And I cannot ask for a better place to have a show where I absolutely would need to introduce him, right? Because you got to be there to support your people. I got to go. I've already warned my husband. That's a very, very high probable situation that I'm traveling to Hawaii. All right, so he's a 43-year-old survivor. I can't even say of just an aortic dissection. This guy, oh my gosh, you would not even believe. I told him when I found out his age and I looked at him, I'm like, how did you age backwards after all these medical things that happened to you? It's just insane. But boy, has he been through the ringer. So, comedian, sports analyst, security guard, podcaster, and these were all the things he was doing up until the moment of his incident. And he is originally from Seattle, Washington, but is moving to Hawaii in Honolulu in May. So he went from being on a third date. He was on his third date with his now current girlfriend. He went from doing that to waking up from a femoral bypass, only to be told he was going to need a quadruple bypass, okay, the following day. So in this 24-hour time period, he has all these jobs, he has a girlfriend, he has a femoral bypass, has a quadruple bypass, and then has an aortic dissection. Like, this is insane that all of this stuff happened to him. You do not hear stories like this. So he had this aortic dissection that took place during or was right after his femoral bypass. He went into the hospital on the 16th. It was discharged on the 29th. He said due to a lot of willpower, he wanted out. You know, when you want out, you're going to find a way to get out. He tries to laugh off and joke about the trauma that he's been through. You know, laughter is sometimes part of the best medication regimen we can be on. And it's sometimes what we need to do to get through these traumatic moments. But you can find him on something called Suit Man Productions. And it's also on YouTube if you want to get a taste of this very interesting humor. And I hope that he can bring some levity and humor to this community. And I'd like to just say I welcome Dante. Yay, Dante.
Welcome, Dante.
All right. Feel Good Friday. Not my forte. When I saw this, I'm like, I got nothing really much to say. But March Madness, I will say that it is kind of cool that at the buzzer Hail Mary situation, right? That the University of Maryland is in the Sweet 16. Now, am I saying all this right? Because this is not my thing. It's not my jam, but it's still in Maryland. So I was
Well
kind of
done.
excited. Thank you. I used the words correctly. That's awesome. Yay. Okay. So the Friday post was who else was caught up in this madness? Clearly, Maryland people were caught up in the madness. So whether you're a diehard fan or just love the buzzer beaters and bracket surprises, obviously this was one of them. Uh, the post was all about like, we want to hear from you. Do you follow March Madness? I do not. Who's your pick to win it all? Who is your pick to win it all? Do you have a pick, Josh?
I do not follow college sports in any way, shape, or form.
No, I do not either. I do not. No. So then I guess we don't have much to talk about when it comes to March
Yep, I got
Madness.
nothing. If you
That's okay.
are a Max.com subscriber, they are featuring the entire thing on Max Live.
Oh,
I found
okay.
out
I
about it
am.
yesterday. And what
Ah,
was very interesting is when you click to watch, it'll put
yeah.
all of the concurrent games on the screen at once.
Oh, that's pretty
And I was
cool.
like, this is what they need to do for the NFL.
Yeah, absolutely. But that would end up being like some kind of pay-per-view. But that's pretty cool. Well, you're paying anyway for the channel. What's it matter, right?
I loved it. And you can just like pick
Yeah.
and choose. So like if you're listening to one and a commercial comes on, you can click the
Yep.
other game and then
Oh,
the
that's great.
audio switches over. You
Good.
can expand it. You can, I was like, this is exactly what we're looking for this kind of event. Well
Very
done,
good.
Max.com.
Woohoo. All right. You guys, we need to give a huge shout out, congratulations to Adam Ahmed on matching for his residency, and he will be going to the University of Pittsburgh Medical Center. There he is. So excited for all of your hard work. All of your hard work has truly paid off. We could not be more proud of you to have you start with us as a med student, and now you're going to be doing your residency as a doctor at the University of Pittsburgh, which is so exciting because you're not that far from us, folks that are here in Maryland. Yeah, we're so excited for you. It was great to watch. I watched the match day. I think it was over at Baylor, and I got a chance to see that live. And I know everybody across the country had their match day the other day. So hats off to you. Super excited. And if those of you don't realize, Duke, I hope his last name is pronounced Gao, Giao. He was with us as well. And then he got his residency a year or two ago, and he's been at Cedars-Sinai as a doctor. And they're both in cardiothoracic surgery. So, so exciting. And I know he's super excited, and we're excited for him. So, yay, Adam. Good job. All right, that leaves us to the Survivor Series. So there you go. There's a picture of like Dante as Suitman, right? He did his live Survivor Series this past Saturday night. I hope you guys got a chance to check it out. Of course, I did not because I was in my fundraiser. I did peek a couple times, and I was like, "This is most certainly no longer a G-rated event," and that's okay because you know what? You guys got to use language to describe your event. Go for the language. I get very embarrassed. I do curse. My son knows I do. I don't curse in front of my mom, never did in front of my parents, and I probably will never online. It would have to be something so outrageous to make me do it. I probably have in a blooper, but he did, and it fit perfectly. It was
No,
beautifully.
no, you've
What?
never cursed in a blooper.
I no,
You've
I
never
do
cursed
not.
in a blooper. Mm-mm, not at all.
I
Anytime I'm
didn't.
recording, you've never cursed.
Ah,
Yeah, I can assure
right.
you. I can assure you of that.
It's because it's so infrequent
Because
that you
here's
would
the
be
thing.
like, "Wow,
Here's no,
she
no,
just
no.
said a bad
Not
word."
only that, I would clip it and send it to you.
Because I just don't know why. I don't know why I just don't do it. I don't do it. I don't. But I can, like a sailor, but I just don't.
Hold on,
I'm
Velda
not that
here. She
colorful.
says, "I watched Dante. Good storyteller. Loved his
Oh.
cursing."
Oh,
Yeah,
yay.
yeah.
Good. That's
So
great.
from my perspective, right? First off,
Yeah.
yes, he's a talented storyteller. That's the first thing, right?
Yeah.
When you start his story from the beginning, I mean, it's like a rom com. Like you
Mhm.
feel like you're like hearing the story of a rom com,
Right.
and then it turns into a nightmare scenario,
Nightmare. Yeah.
right? And so
Mhm.
like it's visceral. He's 3 months out
Yeah.
from his dissection, so things are
Isn't that
still
insane?
very fresh.
They're very fresh, and I've
Yeah.
watched some of the bumps, and I know he's had some loss, and I know all of that's still fresh too. And I think what's so great, and I told him this about watching him go live every now and then when he's in the car driving and he's like thinking about his mom or he's thinking about life, is he is free with his emotions. There is no holding back. And then, then you see him a couple days later and you see him when he's back in that today's a great day and I will appreciate today. And it's like, oh, Dante, that's great. I just love that because it's real, and he just reminds me a lot about myself, um, and I can appreciate how he is him. You know what I mean? I appreciate it's a freshness. It's something very different, I think, than we've seen um, in a while, and I like it, and I'm excited to see more. I want more, so it's
and
great.
and I believe I still owe his girl Tessa another apology. I misread her name when she chatted
What'd you see?
in.
Was Tesla?
I think I said Teresa,
Oh,
and
okay.
so she was out of town with a friend of hers, and so she texted him and she's like, "Oh, he said my name wrong. Now my friend who she's like traveling with is gonna call her Teresa all weekend." I was like,
That's okay.
"You're welcome."
She's Teresa and I got butchered because I spelled it DAU. So, and he's like, it's fine. Nobody gets it right. I'm like, but I did. I got it right. It was autocorrect that got it wrong. So, but it's all good. It's all good. So you guys should check it out. Okay. And there's also, there's a link to that there for you to see
Oh,
it. There's also a link to the form if you want to sign up to be part of the Survivor series.
and FYI, this is a
Yeah.
2 hour event.
Really?
Yeah, yeah. He
Wow.
doesn't spare details. He goes for it. Excellent story.
I,
I loved it. I loved it.
I went to bed early, so yeah, I missed it. I'm sorry. I will watch it. I'm very excited about it, though. I did watch a little bit, and then I was like, "Oh boy." Hopefully, all the language went over, but Velda loved it, so that's great. All right. Look, I'm gonna bring us to care packages now, because that's also important. And we may have sent one to Dante. I can't remember, but care packages are, it's one of those things. They're not happening all the time. Thank goodness. If they were, I'd be pretty sad, right? But if you or your loved one has had surgery in the last month, okay, don't write us because something happened last year because that's not kind of like not really fair. But if it's within the last month or we know surgery is coming back, and you want a care package, definitely fill out the form, okay? And once we get it, we're going to send it to you within 2 weeks after receiving it. So if surgery happens, it should be arriving, you know, fairly close to surgery. So items in the care package can vary, all right? But what you're going to find is if you had a dissection or even if you had open heart surgery, you will get a copy of Aortic Dissection, the patient guide. That will automatically go in there for you. If you had valve replacement, or you knew you had an aneurysm and that was being replaced, moving forward, as soon as we have our books printed, you will receive a copy of Aortic Disease, the patient guide. That will be in there. Okay. You will probably potentially have lip balm. That's always important. A pill case keychain. That's always good to take a couple pills on the road. You might have an ice/heat pack. That's also very good to have. Treaded socks, journal, pen. There could be a variety of other things just to get you started and being part of the Aortic Hope community. So send some hope, feel supported today. Just got to click on that link. And that brings us to our events page. Okay. You always update this. I love it. I am not Tammy. Not Tammy. If you guys were wondering, just going to bring that back up. All right, tomorrow we have a great live event tomorrow night with Dr. Pedro Catarino from Cedar Sinai's will be joining us. I wrote him and I said, I really want to focus our attention on everything valve. We just came out of aortic valve, or not aortic, but heart valve disease awareness day on February 22nd. I could not get Dr. Catarino to commit in February, so I moved him here and we're committed now. And so we're going to talk about aortic valve disease, diagnosis, monitoring, and treatment plans. We're going to talk a little bit about the genetics involved in these scenarios, definitely with bicuspid, which is a congenital heart defect, but is now known to be hereditary. And we're going to talk about all of the different types of valves that are being offered now, different scenarios where you might choose one over another. There's still some concern, question, confusion about these valves, and I want him to show us do a little show and tell. So we're going to get to see things too. He'll hold them up. That's going to be great. You can come prepared with questions to ask. Just remember, whatever you type here on YouTube's going to live here forever. So if you don't want anybody to know your handle, your user ID, your name, there will be a link to a form where you can send us an anonymous question. Okay, so that'll be happening tomorrow night on the 25th at 7 p.m. Eastern. Then we have our last support group meeting of the month. That is going to be happening on Wednesday at 7 p.m. Open to all. You register once, you'll be notified by email just shortly before the meeting with a link to join via Microsoft Teams. So make sure you've got that downloaded. This week's Coming Up Therapeutic Thursday with John Quick. I am pretty confident that we have Diane Bishop from Aortic Health Unlimited. She's also the aortic artist. She's also moderating the WISE support group meeting, which is Women Inspiring Support and Empowerment with Aortic Disease. She's going to be joining as a guest. So we're going to get to hear her journey of emotional, mental issues, problems, joys. I don't know, all the stuff, emotional and mental, that can happen that comes with aortic disease. She's going to be talking about it. Okay, so we're excited to hear what she might have to say, and you can ask questions of her as well. And then obviously we wrap up the month with Sunday's Qigong at 12:30, another final weekend review with me for the month of March, and then the support group meeting on Monday the 31st at 7 p.m. I will be starting the process of filling in the month of April. I've already got, there's a couple live events. We've got a community member with aortic athletes. We've got Dr. Udaly is locked and loaded for the month of April. And we might have a visitor in the women's support group with Dr. Fisher, who also does a lot of OB stuff when it comes to aortic disease as well. So that's just the start of April. I would like to give a personal shout out to Michael Pace. He is a community member. We will be posting information about him soon. He is running in a Spartan race, you guys, in a Spartan race with aortic disease. And he is doing so this Saturday in Florida. We wish him luck. He's been raising money for Aortic Hope regarding this. And so we're super excited for him. And we will post that information today or tomorrow, as well as give you updates on what happened with that race. So look out for that. And that's all I got. That's all I got. That was a lot, but I'm so happy that you joined me. So thank you to Molly and Tom and Christina and Velda. And hey, happy pre-birthday to Molly. Yep, I said it. I let the cat out of the bag. She's going to be 35, and that's a great special number, and we wish her a very happy birthday.
I had a meeting with Molly this morning. I meet with her every
Yeah.
Monday. And they have an excellent weekend planned. It is going to be awesome. I never in my life have ever heard of wine trains.
What train? Wine train?
Wine trains. This is a
Blind?
train. No. This is a wine train that goes through Napa Valley, where you get on the train, you go to the next vineyard, you do your tastings, you get back on the train. That sounds awesome.
Yeah. You're not driving drunk. You're just going to chill out and
On a
take a little
train.
snoozy till the next stop. Yeah.
Not a caravan of cars,
No,
not like
it's going to be
a
beautiful.
bus. It's so good. Oh, I'm
It's going to be
nerding out about
beautiful.
it. That's so good.
That's a lot of fun. That's exciting. That's
Yeah.
very exciting. Well, good for her. And she'll have a wonderful birthday and we're excited for her. All right, everybody, do me a favor. Please click that like button. It's so important. Click subscribe so you're notified when we go live this week. Um, don't don't we have, wait a minute, we have something else this week. Did I miss something on here? Oh, I'm taking a quick peek. Taking a quick peek.
Are
Oh
you
no,
thinking about the
we don't.
Aortic kitchen that starts next week or starts in April?
Mm, possibly. Um, yeah, no, I was also starting to think about aortic artist. Yeah, I thought that was this month, but maybe it's in April. I'm not too sure. Maybe I don't know even know what today's date is, but that's okay. I'll fix it.
Okay.
Yeah, no, I know Aorta Kitchen picks back up again next Thursday, first Thursday in April. That's exciting. So we'll get that all posted for you. And share this. Share this on your page because I guarantee you somebody's going to find this really fascinating and interesting and the survivor stories and the resources and everything. So definitely share that and I guess I'll talk to you guys next Monday. I'm going to see you guys tomorrow if you join me for this amazing live event because Dr. Caterino, he's a ton of fun. So otherwise, I'll see the rest of you next Monday, 3 p.m. Eastern for our next week in review. Have a great week. See ya.